Mates came about when some key stakeholders in the construction industry, they recognised that the rates of suicide seemed to be higher. And what they actually did, so unions, employer associations together in an organisation called a redundancy fund, and they were seeing that death claims come across the desk that too many of them were deaths by suicide. And so they established the need to actually clarify, is this just anecdotal or actually is this real? And that piece of work showed definitively that there were significantly higher rates of suicide in construction, men working in construction, than the general male working populations.
There's no shortage of problems to be investigating, sadly, when we talk about work and health, and in particular work and mental health. So the first studies around how work can influence mental health have, particularly in an adverse way, tended to focus on depression because depression is one of the most common mental disorders. What is it about construction in particular for men working there? Well, it's the low security of the work, bouts of unemployment off and on. There's working at a distance from home, there's having to travel far. So when you're doing it tough, you tend to bottle it up more or maybe cope with it through alcohol and other drugs.
Blokes don't speak or don't tend to. Every odd bloke, they're very sort of empathetic with their views. But again, it's just to emphasise, to the blokes, how important it is to keep their mental health there. Because obviously, you go to work and you also take that back to the families as well. So if you're having a bad day, you sort of take it home and your wife gets in, and unfortunately sometimes the kids might get it or the immediate family might get it.
When Mates works well, it actually becomes part of the fabric of the work site. So Mates programs are about building that help offering capacity, building a sense of community in the workplace where we all actively look out for each other and then step in when someone needs help and connect them to the help that they actually need.
Suicide, mental health, construction industry, it's too much, we all know someone who's been affected by either suicide or mental health, after you've been in the game for a little while. Sometimes when you first get in the game, it happens.
With Mates, you're right there at the coalface, collaborating with Mates staff in the research, seeing real people and knowing about impacts and hearing about personal stories. It grounds what I do very thoroughly. A lot of the research was observational, meaning looking at suicide rates in the sector, looking at participants in the program, how much they've changed from before the program to after the program. We've been able to show that the suicide rate in construction workers is coming down, and it's coming down faster than other working males.
Yeah, so the reason that we partner with the Institute, the IHT, through having Tony on our board is it's manifold, but one of the real strengths that it delivers for us is diversity of thinking, diversity of approach, diversity of experience. We've got construction experience on our board. We've got people of depth of experience from different places. But that sort of partnership, that's nothing we can't take that for granted. We know that that's actually a strength in terms of how we work, and that's something that we really value. What Tony brings to the board is something that allows us to actually step forward and be clear and structured in how we actually drive the work of Mates. For us, one of the real strengths has been that we've built integrity, strength and believability in terms of our evidence base, but also in terms of our broader strategic thinking. So for me, that'd be one of the key reasons why I'd be looking to partner with IHT and brilliant researchers that they've actually got working through there. Having Tony on board has delivered that for us, and it's real.